Okay, so good morning. We're going to get started. Apologies for the delay. We're pulling together a bit of material for this morning's presentation here. Welcome back. I thought I'd begin the day, as I am wont, with a bit of a retrospective on the previous day, to think a little bit about some of the material we encountered yesterday and some of the learning on a couple points of relevance for thinking about the studies that are currently taking place. So yesterday we began with a discussion of some of the compelling value propositions offered by smartphone-based mediated data collection for a variety of subdomains within health. And I emphasized a couple of points of particular note there. One thing is that this sort of data collection does confer value at many different levels of healthcare needs and health-oriented analysis, from the level of clinical factors involving self-management, involving the role of informal caregivers, up through the issues having to do with clinical encounters and clinical management of patients. Health service delivery issues, issues having to do with operational or tactical decision-making, informing day-to-day decisions, and then at the strategic planning level, something we'll be talking about a little bit more tomorrow when it comes to integration of this sort of data with dynamic models. And although we didn't have time to go into it in detail, I noted that these sort of data that are collected from devices such as smartphones and increasingly wearables confer a number of highly desirable features for analysis within the health space. And I highlighted four areas of particular interest, or particular what I consider compelling value propositions when you bring together the data that you're gathering from these phones right now and health analysis needs. In one of them, we talked about how the data collected could help alert us to exposures or other encounters that might be of value in understanding health outcomes. An example here is actually one that's seen in several of the projects. For example, in the West Nile virus-oriented mosquito-borne illness project, where data is being collected now, some record of risk behavior on the part of a person, which might otherwise be hard to collect, when they're outside, what sort of personal protective behavior they're wearing, whether they have bug spray on. That information can be collected on the device, both through a combination of sensor data, GPS, other aspects of location as indicated by Wi-Fi, to help us judge whether they're indoors and outdoors and where they are outdoors. And it can be cross-linked with data regarding from self-reports by the participant. Self-report, for example, as to whether they are wearing long sleeves and long pants, and whether they have DEET-based mosquito repellent on. So this is an example where we might gain some understanding of likely exposures from that information that could help us better understand eventual outcomes associated with presentation with possible, say, West Nile fever or other outcomes associated with West Nile infection that might be more serious and be associated with presentation. In another case, we were looking at for the studies underway, we were looking at exposure to chemicals, household cleaners or detergents, personal care products. And by better understanding the degree of exposure, as indicated by the person by photographing the product and perhaps in indicating how much they were exposed, we might get some sense of a dose dosing, and we might be able to link that to outcomes, outcomes that might be health-related in the form of, say, coughing and wheezing, if it's associated with respiration or rashes or other possible adverse events that might extend from this. So by collecting data at this micro level, we might be able to better understand variability that we see in outcomes, more reliably tracing the effect of exposure to its outcome than we could if we were depending on very aggregate self-reports by individuals. And indeed, many of our studies are motivated by that. Another that I highlight is our work with gestational diabetics, where we know outcome data for mom and baby, and where, with a better understanding of sedentary behavior and physical activity and stressors in the context of pregnancy, we might better understand the outcome, the variability in outcomes. Another compelling use of this data, I argued, was understanding sort of the texture of and rhythms of daily life that might elude us on traditional survey instruments. So here we're trying to understand aspects of human day-to-day circulation that might be relevant for understanding health outcomes at somewhat of a broader level, not so much in a dose-response type of fashion, but interested in understanding, for example, the degree to which different people differ in terms of the level of structure in their lives, the extent of their activity spaces, where they circulate in the course of a day, not only their home location, but where they actually travel to in the course of their toing and froing to work. And this, too, can enhance our analysis. A third level of sort of discussion I had was one centered around the issue of intervention, better understanding the pathways by which interventions succeed or fail to succeed in changing behavior. And I gave that example of a move to a new neighborhood, from a low-income to a mixed-income neighborhood, and argued that with the sort of data we're collecting here, we can better discern which aspects of people's behavior have been changed most extensively by a move like that or by another intervention, and which actually were subject to less change. And that can help better planning of future interventions as well. And I had listed for this set of possible general sort of rubrics applications to a set of different areas of health. But these general features of the situation apply to many different subdomains within the health context. After this motivation, we went on to hear through Kevin about a lot of the types of data that can be collected via these sort of phones and federated devices. And to be sure, this includes a wide variety of sensors. Kevin had noted the presence of something like 25 to 30 sensors on these phones that are collected by the Epica system. And as new phone models come out, the list grows and grows. In addition to that, though, we have the very important ability to self-report in a sort of crowdsourcing fashion, certain types of study-specific information and respond to surveys in a fashion that elicits more reliable response than what can be traditionally solicited via, say, random digit dialing or surveys initiated by interviewers. So within this context, we have phones as a sensor platform, but they secure much of their value by cross-linking that to various types of self-report. We also saw that the phones increasingly are embedded in an ecosystem of other devices, with the greatest growth right now in wearables, things like the Fitbit or Jawbone, the Mio watch that was mentioned, and increasingly devices that may be integrated into aspects of clothing, et cetera, to collect more physiologically relevant data. And this is a big area of growth, and the platforms that you heard about yesterday are both likely going to be targeting themselves to serve as kind of an aggregator for various sorts of streams of data coming from many devices. So Michael Long, who I don't know if he's here yet this morning, but he's been very involved in integrating data streams from the Mio watch so that it's collected by IAPI. And one of the key needs of that is not just convenience, not just the fact that we can put that data then into the database, but we could actually potentially process it and use it to, say, inform the delivery of surveys to individuals. So by cross-linking it with the data from the devices, we can gain extra insight as to the appropriateness of certain questions for people, to ask people questions in a very targeted context, and we can also use that data for the sorts of analysis we'll be talking about later this morning. So Kevin talked about the different types of sensors available and noted that they differ in terms of many of their details. There are some types of sensors on board these devices that are distinguished from being more power hungry, for example, whereas others are more power sipping. The phone itself requires time sometimes to sync in with, say, satellites to collect GPS data, and that can't be measured on a moment-by-moment basis without some delay with getting connected to satellites. So there are some challenges associated with particular sensors that means that we can't put them all into the same sort of fixed framework for exactly when the data is collected and exactly how often it is collected. So sensor types are proliferating. Being aware of what the sensors give you and what they don't give you is important for making sense of this data. And some of the analysis we'll see later this morning will build on that, recognizing, for example, that GPS data has quite a bit of noise associated with it. That if you're inside a building like this, the GPS connectivity may be very limited in the interiors and may be quite inaccurate even if you're near the windows. So there are certain types of analysis needs or certain types of information that need to be collected that will motivate you for selecting subsets of sensors, and that subset needs to be chosen in a judicious fashion so you can secure reliable data, say on location, both indoors and outdoors, without finding yourself at the mercy of some of the artifacts of the data collection infrastructure, say the GPS system more broadly. Following that, Mohammed gave an overview of many of the motivations for the sort of system that he was to demonstrate in successive phases through the day, this Epica data systems infrastructure, which provides a web-enabled platform for people to enroll in studies, to manage studies, and to provide some basic analyses so that you can monitor compliance and so that you can gain some understanding of the participant pool if you're a study manager. We also saw in the afternoon some aspects of the interface for that system on the phones for enrolling. And in fact, Mohammed worked with many of the teams to try to apply the needs of each of the groups within the context of his system. And my understanding is that those data collection episodes are ongoing right now. Is that right, Mohammed?
One issue is one of the surveys last night that I did some modifications, but I will give the details. I'll talk about the details after yours.
Okay. A very important component of that system is the fact that a given phone can download the app from Google from the Play Store, which is a standard mechanism for getting apps on Android phones. And having downloaded it, that given phone can then enroll in as many studies as desired. And each of those studies may have somewhat different needs in terms of the sensor data collected and the particulars of the survey instruments or other aspects of the user interface that are required. And the group projects that were launched yesterday were tapping into that strength. So yesterday's session gave a glimpse of a lot of what was required to start thinking about planning a study and to get that study off the ground in terms of data collection. Today's sessions are focused more along issues of what you do while a study is running and following its running. This will include a discussion of compliance and monitoring associated with a study, where you'll again see glimpses of the Epica system. And we'll also be talking about various measures and ways of sort of characterizing compliance that we found useful within ongoing studies and past contexts. We're also going to be taking a look at several ways in which data can be analyzed, either on a quick turnaround basis or more typically on a basis that might be used to identify salient patterns and to work towards identifying features of study results that would be suitable for publication. So we're going to be looking at two tools, most significantly Tableau, and then giving a brief glimpse of how the popular tool R can also be used to draw in data from of the sort that's being collected for your studies. This afternoon, we're going to have some additional project work to help give you some legs up on getting your projects further along, and taking a look at some of the compliance data and other outputs from the Epica system for projects. So that's sort of what's coming up today. Any questions before we get started? Housekeeping needs? Any topics people would really like to see addressed in the course of the day? Okay. We'll get a chance to talk additionally over lunch. We're going to have a little bit more time assigned to that by request. So we'll see if we can use that also as an opportunity for